Since we are working in a virtual format today, I'd like to go over a few housekeeping items before I proceed. I'm sure everyone is very familiar with them, but we are required to do so. So here we go. First, if you're experiencing connectivity issues, please make sure you or your staff contact our designated technical support so it can be resolved immediately. Members participating remotely must continue to use the video function for the duration of their participation in the hearing unless they experience connectivity issues or other technical problems that render the member unable to fully participate on camera. It is committee policy that members will remain muted when not recognized, just like turning your microphone on and off during a hearing in person. This is out of courtesy to all members on the committee, and so that background noise does not interfere with another member who is recognized to speak. When you are recognized, you will need to unmute your microphone and pause for a couple of seconds before speaking so that we will be able to hear everything you say. If you wish to be recognized, please raise your hand using the Zoom raise hand function, unmute your microphone, and ask to be recognized. In order to ensure everything members say is captured on the live stream of this hearing, I ask that members pause for 2 to 3 seconds before beginning to speak. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteranaffairs.hearings@mail.house.gov. It will be uploaded to the committee document repository. Please keep in mind that you will need to refresh the repository page as it does not automatically update. Without objection, members will be recognized in order of seniority for questioning witnesses. This makes it easier for me to make sure all members participating have an opportunity to be recognized. Does any member have a question about the conduct of this hearing with members participating remotely? Hearing none, I now recognize myself for an opening statement. Good morning or good afternoon, wherever each one of the members are. Thank you all for joining us today for the Health Subcommittee's second legislative hearing of the 117th Congress. Today's agenda includes legislation covering a broad array of issues. Each piece of legislation is in response to a serious issue or concern affecting our veterans' health care. As a sponsor or co-sponsor of several of the bills before the subcommittee today, I am proud of the work being done within this committee and throughout this Congress to preserve and enhance the care and services at VA that so many veterans utilize, value, and recommend. In recent months, this committee has shown a spotlight on VA's infrastructure needs. During these conversations, it's been acknowledged VA needs authorities that allow them to be nimble and bring care closer to veteran populations. 21st century medicine is constantly changing. Building facilities from the ground up aren't always the best use of limited funds. Leasing facilities offer greater flexibility. Since 2012, CBO has changed how they score leases, and this in turn has created a backlog of authorizations. My bill, Build a Better VA, would address this long-standing issue. Currently, we have 4 fiscal years worth of leases, 21 projects in total, all across the country, waiting for Congress to address. I hope my colleagues will support this effort. I know some of you on the committee have outstanding leases in your districts. This legislation would allow those projects to move forward in an expeditious manner. I'm also pleased that we will be considering the VA Continuing Professional Education Modernization Act today, a bipartisan bill that Representative Miller Meeks and I recently introduced. This bill will expand VA's existing continuing professional education program from only board-certified physicians and dentists to all types of VA clinicians, nurses, psychologists, physician assistants, and other types of VA clinicians who have never previously been eligible for VA reimbursement for CPE expenses would receive an allowance of up to $2,000 per year. The allowance for physicians and dentists, which is currently capped at $1,000 per year, would be increased to $4,000 a year. This would be the first increase in VA's CPE allowance since the benefit was first established 30 years ago. Providing allowances to reimburse tuition, course fees, and travel expenses associated with continuing education for all of VA's clinical staff will help improve employee recruitment and retention. I urge my colleagues on both sides of the aisle to join Dr. Miller-Meeks and me in supporting this bill, which will help make VA a more competitive employer while enhancing the clinical knowledge of VA healthcare professionals. In closing, I look forward to today's conversation. Your expertise and input are valuable to us as we craft legislation. Before I recognize General Bergman for his opening statement, I would like to acknowledge that our chairman, Chairman Takano, is joining us today. He will forego, is my understanding, an opening statement now and save his comments for his draft bill. The VA Infrastructure Powers Exceptional Research Act, known as VIPER, which is on the agenda today. With that, I'd like to recognize Ranking Member Bergman for 5 minutes for any opening remarks he may wish to make. General Bergman?
Yeah, thank you, Chairwoman Brownlee, and thanks to everybody for being here today. This is time well spent with all of us together. And with our colleagues and friends from on and off the committee, from the Department of VA, and from the VSOs. We're all in this together. This afternoon, we'll be discussing 12 largely bipartisan bills to improve various aspects of the VA healthcare system to better serve our nation's veterans. I am supportive of many of these bills on today's agenda. I am particularly supportive of the bill HR 4233, the Student Veterans Counseling Centers Eligibility Act, that is sponsored by Dr. Murphy and Ranking Member Bost. The Student Veterans Counseling Centers Eligibility Act would allow student veterans to access peer support and counseling at vet centers. We know that student veterans face particular challenges adjusting from military life to student life. School can be stressful for anyone, but especially for veterans who are non-traditional and often first generation post-secondary students. Dr. Murphy's bill would give them an additional avenue of support to ensure that they can successfully transition out of the military, readjust to civilian life, and pursue their educational goals. I am proud to sponsor 2 of the bills on today's agenda: the draft bill regarding VA's family caregiver program and the draft bill to require an independent assessment of the VA healthcare system once every decade. My draft bill regarding the VA family caregiver program would preserve the clinical nature of the program that Congress and stakeholders always intended. It would allow VA to complete the expansion of the program to pre-9/11 veterans and their caregivers when VA is ready, rather than waiting until October 2022. It would also require a report on veterans whose applications for the family caregiver program were denied because VA deemed participation in the program to be against the veteran's best medical interest. I drafted this bill after this subcommittee's roundtable discussion on the family caregiver program in late April about the first phase of expansion. It incorporated many of the concerns raised during the discussion by VA, VSOs, and lawmakers from both sides of the aisle. I'm confident they would help sustain and improve this important program for generations of veterans and caregivers to come. My other draft bill to require an independent assessment of the VA healthcare system once every decade would do just that. We require an independent, top-to-bottom assessment of the VA healthcare system by objective, expert entities once every 10 years. The original independent assessment was required by the Choice Act of 2014 and released in 2015. That assessment has proved invaluable ever since. Its influence can be seen in the work that Congress and the VA have done, including the Mission Act and the improved access, quality, and trust scores that VA experienced over the last 6 years. It would be a mistake to let the assessment be one and done. VA is changing. The delivery of healthcare is changing. The veteran community is changing. It would be a disservice not to have a mechanism like the one my bill would create to objectively assess how well the VA healthcare system is adapting to those changes and performing its critical mission for veterans. I am grateful to all of our witnesses and those organizations that submitted statements for the record for their thoughtful feedback on my bills and the other bills on today's agenda. I look forward to learning more about each of these pieces of legislation and the impact they would have this afternoon so that we could make sure that they are the best that they can be before hopefully advancing them through the committee and then on to the House floor. With that, Madam Chairwoman, I yield back.
Thank you, General. And we will now welcome our first panel where we will hear from colleagues who have sponsored legislation on today's agenda. And I will begin by recognizing Chairman Takano for 3 minutes for any remarks he may wish to make in support of his draft bill, the Viper Act. Mr. Chairman.
Thank you, Chairwoman Brownlee. I appreciate this opportunity to speak on my bill, the Viper Act. I'm pleased that the VA Infrastructure Powers Exceptional Research, or Viper Act of 2021, is being heard today in this legislative hearing. Through the investments in the American Jobs Plan, we can restore veterans' faith in VA by literally rebuilding the physical infrastructure of the VA system. But it's also critical that we recruit world-class scientists for these facilities by updating VA's research capabilities. That's where my Viper Act steps in. This bill was developed in consultation with expert scientists and stakeholders to give VA the additional authorities it needs to make its world-class research program even more efficient, innovative, and successful as a direct means of improving the lives of the veterans it serves. It's no secret that VA research is a jewel in VA's crown, and we need to ensure that VA can continue to be competitive in hiring the finest scientists to understand, prevent, and treat the health challenges veterans face, from the effects of military toxic exposures and chronic pain to post-traumatic stress disorder and traumatic brain injury. The Viper Act will streamline overly burdensome paperwork requirements so that VA scientists and administrators may focus squarely on appropriate reporting of VA research projects, allow VA more efficiently and successfully recruit and retain data scientists and researchers on loan from other federal agencies. It will also give VA other transactional authority in line with 11 federal government agencies to more creatively partner with visionary scientific entities. It will authorize appropriations for critical VA research facility repairs and information technology upgrades. And it will create opportunities for researchers at smaller colleges and universities to work with VA scientist mentors and expand the STEM pipeline serving veterans. We shared this draft of Viper with VA for its comments for over 4 months ago, and only recently received some technical assistance back. Based on VA's testimony today, I do believe that we'll be able to quickly iron out language that will satisfy all involved. I'm thrilled to hear of VA support for the bill and the endorsements from VSOs, including the American Legion, VFW, and Disabled American Veterans, as well as independent scientific organizations whose members spend careers as VA researchers. It is my hope to introduce Viper soon with bipartisan and ideally bicameral support. It should not be controversial to give VA researchers the tools and resources they need to serve all those who have served. Thank you, Chairwoman Brownlee, and I yield back.
Thank you, Chairman Takano. I'm really looking forward to co-sponsoring your bill. And I know the Health Subcommittee over the years has had several hearings around VA research and development. And it is obviously critically important that we drill down and dig deep, particularly around issues that affect our health issues that affect our veterans. And certainly it has been a very valuable investment for the the medical community at large. So thank you for putting that forward. Representative Pappas, you are now recognized for 3 minutes to deliver a statement in support of your legislation, HR 2797, the National Green Alert Act 2021.
Well, thank you, Madam Chair, for recognizing me and for including my bill in part of, in today's hearing. It's HR 2797, the National Green Alert Act, and I introduced this bill alongside Representative Miller Meeks. It's a bipartisan, bicameral bill that would assist states in creating green alert systems. These are similar to Amber Alerts in that they locate at-risk veterans when they go missing so they can receive appropriate care. We know that too many of our brave veterans experience mental and emotional trauma as a result of their service to the country, and we're familiar with the tragedy that occurs each and every day in this country when we lose 20 veterans and service members to suicide. It's a tragic number that underscores that treating mental health is an essential aspect of providing full care, and we've got so much more work to do on this front. So green alert systems are just one tool that some states are successfully using to help prevent self-harm and other tragedies among veterans. It's similar to the Amber Alert and the Silver Alert systems that certain states have implemented. And a green alert system is a communications network that allows law enforcement and the public, in the event of an at-risk veteran's disappearance, to be able to locate that individual and connect them with services. When implemented, these systems can assist in locating that veteran, and it's just essential and so timely to provide that care at that point in time. The National Green Alert Act would create an interagency commission to develop best practices, to provide technical assistance as well to states who establish these green alert systems. And in addition, the commission would provide a report to Congress after 2 years on recommendations for any appropriate additional actions to support states as they develop these systems. Again, it's bipartisan legislation. I think it's a common sense step that we can take to ensure that we're providing the right support and resources at the right time to veterans who have given everything for this country. This legislation will greatly improve an at-risk veteran's chance of returning home safely, and will also further the goal of this committee and this Congress to protect the men and women who have worn the uniform of this country. I thank you for the time to present this legislation, and I yield back.
I keep getting muted, I apologize. So thank you, Congressman Pappas, and Congressman Lamb, you are now recognized for 3 minutes to deliver remarks in support of your legislation, HR 2587, supporting education recognition for veterans serving veterans during emergencies, or the SERVE Act. You are recognized.
Thank you, Madam Chair, and I really appreciate you including the SERVE Act in today's proceedings. Basically, when the pandemic began, I'm sure everybody saw this, veterans were often the first and most willing people to step up and try to help fill any unmet need, but especially in the medical field. We have so many veterans with such good medical training from their time on active duty. And when we started looking into it, we found that the credentialing system for such veterans and getting veterans into frontline provider jobs is nowhere near as good as it should be. So even though it feels like the pandemic is receding in some places, I think this is still a very worthy bill. Essentially, we will allow veterans to volunteer their information on a web portal through the VA, which can then be shared with state departments of Veterans Affairs, state credentialing agencies, anyone interested in attracting veterans and their skill set into the medical provider field. We also will be able to use this to hire directly into the VA medical system through the ICT program, which is already successful, but this bill will permanently authorize it, which I think will really help some of what we've been doing with the VA workforce as well, and trying to fill the unfilled spots and keep all the people that the VA very smartly hired during the pandemic. So this solves a lot of problems at once with some really good people behind it. I want to enter into the record a petition that was started by the Iraq and Afghanistan war veterans and Team Rubicon during the pandemic to take a look at this problem. Madam Chair, I ask your leave to enter that petition into the record.
Without objection, so entered.
Thank you. And I just want to show that the veterans community, particularly younger veterans, are very much behind this. as is the Union Veterans Project over at the AFL-CIO. So I want to thank all three of those groups for their work, and especially thank Representative Gonzalez-Colon for helping me on this bill. And Madam Chair, I yield back.
Thank you, Congressman Lamb. It's an important measure to improve our ability and the ability of our veterans with medical training to assist in the United States in response to national emergencies. Sadly, we've experienced those and know the importance. So thank you for pursuing this concept. So Congressman Crow, you're now recognized for 3 minutes to deliver a statement in support of your bill, H.R. 3027, the Veterans Improved Access to Care Act of 2021.
Thank you, Chairwoman Brownlee and Ranking Member Bergman, for the opportunity to talk about this bill today, the Veterans Improved Access to Care Act. When I left the Army and made the transition into the civilian life, like many of the people on this Zoom and in this hearing, struggled to manage that system and get timely access to my veterans benefits. Then later, as a veterans advocate, I learned just how devastating these delays can be with regard to access to mental and physical health care for our veterans. Time literally means lives when we're talking about caring for our veterans. Staffing shortages at VA facilities are a persistent and widespread problem that jeopardizes care for veterans. Last year, the VA Inspector General for Healthcare Inspections reported 132 out of 140 facilities had severe staffing shortages. Additionally, 87% of medical center directors reported a severe shortage of medical officers, and 72% reported a severe shortage of nurses. Veterans who have served their country honorably deserve world-class health care, and the VA's current hiring practices are not delivering on this promise. That's why I introduced the Veterans Improved Access to Care Act with Congressman Meyer. Our bill would address severe staff shortages within the VA by expediting the hiring process for medical professionals. This bipartisan legislation would establish a pilot program to expedite the onboarding of licensed medical professionals at understaffed VA facilities across regionally diverse areas. The bill would require at least 10 locations in regionally diverse areas and prioritize areas experiencing hiring shortages of licensed professionals, and at least 3 locations in areas of less than 100,000 people. Lastly, this bill requires the VA Secretary to submit a strategy to Congress to streamline the VA hiring process for medical professionals by half, and an assessment of how the overall certification of professionals' credentials can be expedited. This bill is an important first step to help expedite the hiring process to ensure that our VA facilities are fully staffed. Now, many of us have heard about the problems about wait times. But we can't address wait times when we have tens of thousands of vacant licensed professional staffing at these facilities around the country. Our bill will not solve this, but it's an important first step to addressing how we can reduce that hiring time and get people into the VA system who have a desire to serve our veterans. I appreciate the opportunity to testify before you all on the bill. Would request support for this effort. And with that, I yield back, Chairwoman.
Thank you, Congressman Crow, and thank you for your bill introduction. This is a systemic problem that this committee and the larger committee as a whole grapples with year after year, and it must be addressed and fixed. So thank you for that. Next, we welcome Congresswoman Underwood. You are recognized for 3 minutes of remarks on your bill, H.R. 3452, the Veterans Preventive Health Coverage Fairness Act.
Thank you, Madam Chair. I am honored that our subcommittee is considering H.R. 3452, the Veterans Preventive Health Coverage Fairness Act. This bipartisan bill, which I introduced in May with Representative Anthony Gonzalez from Ohio and Lee Zeldin from New York, would eliminate the financial barriers that prevent veterans from accessing life-saving health services. Under the Affordable Care Act, almost all private healthcare plans are required to provide coverage of preventive services without charging co-payments. However, while most civilians have been able to access preventive services without cost barriers for more than a decade, veterans who receive healthcare through the VA can be charged out-of-pocket costs for services like mammograms, vaccinations, screenings like mental health conditions, and many others. It is unconscionable that veterans who served our country bear financial burdens that most civilians don't have to worry about. And so my Veterans Preventive Health Coverage Fairness Act rights this wrong by eliminating out-of-pocket costs for veterans seeking preventive services that they need and deserve. My bipartisan bicameral bill will ensure that veterans are not charged co-payments for preventive services such as recommended immunizations for vaccine preventable diseases, screenings for cancer, depression, anxiety, diabetes, and other diseases, breastfeeding support for new moms, behavioral health counseling interventions, well-woman visits, and other critical healthcare services for women veterans. The Veterans Preventive Health Coverage Fairness Act is endorsed by the Veterans of Foreign Wars, the VFW, the Disabled American Veterans, Paralyzed Veterans of America, and the Women Veterans Interactive, among others. I would like to thank my bipartisan colleagues on this bill, Representatives Gonzalez and Zeldin, as well as our Senate partners on this legislation, Senator Tammy Duckworth from Illinois and Senator Susan Collins from Maine. Thank you again, Madam Chair, for including our bill in today's hearing, and I urge my colleagues on both sides of the aisle to support this critically important bipartisan legislation, and I yield back.
Thank you, Congresswoman Underwood. We really appreciate your fierce and ongoing commitment to our nation's veterans, and particularly to our women veterans. And this is a great bill to find equity in eliminating co-payments at VA for medications related to preventive health services. So thank you for bringing it forward. And last but not least, I now recognize Dr. Murphy for any remarks you have about HR 4233, the Student Veterans Counseling Centers Eligibility Act, which you recently introduced with Ranking Member Bost and with Ranking Member Bost. Congressman Murphy, the floor is yours. You're muted, sir. You're muted, sir.
There we go.
Yeah, there we go.
Thank you guys very much. Good to see everybody. And thank you, Madam Chairman, for giving me the opportunity to speak. Today, I'd like to advocate for HR 4233. It's the Students Veteran Counseling Centers Eligibility Act, which I introduced along Ranking Member Bost, as you mentioned last month. I'm very happy that we have bipartisan support for this legislation. I know that we're all very acutely aware of the difficulties that veterans often have in transition back to civilian life, especially those who are looking to further their education. Having taken care of veterans and their medical needs for over 30 years, this is a very personal issue for me. Additionally, we have oftentimes seen the tragedy of our selfless defenders losing their battle to mental health issues when returning from service. The intention of this bill is to aid more of our veterans who are readjusting to civilian lives by providing overdue access to vital mental health resources. This is especially personal in my district. I represent about 89,000 veterans, many of whom are or will be receiving benefits via the post 9/11 GI Bill or the Montgomery GI Bill. I urge this committee to see this bill for what it is, an effective and straightforward way to address the most pressing issues for the veterans across our nation. We have an obligation to make counseling services more accessible for veterans, regardless of which side of the aisle that we sit upon. The Veterans Counseling Centers Eligibility Act would provide expanded counseling and mental health services to student veterans through the VA's Readjustment Counseling Centers, also known as VET Centers. These centers provide individual, group, marriage, and family counseling, as well as peer support opportunities for active duty service members, veterans, members of the National Guard and Reserve, and certain military family members. VET centers are community-based, confidential, and free. A recent RAND study showed that 20% of veterans on the GI Bill face issues with either depression or PTSD. That's 20%. That 20% amounts to over 170,000 veterans. That's almost double the number of veterans in my district alone. The current option of student veterans using school psychologists provides little relief for these veterans. The Director of Policy and Advocacy for the National Association of School Psychologists reported that the national ratio of school psychologists to students is 1 to 2,000 and can be as bad as 1 to 5,000 at some schools. Now, some of that is due to money, some of it is due to the scarce resources and the scarce number of psychologists. I've heard personal stories from students who have had to wait weeks or even months for mental health appointments if their mental crisis was not deemed in need of, quote, immediate attention. Unfortunately, many of our veterans do not have the luxury of weeks or months to wait to see a professional mental health provider. In addition, many university mental health counselors are actually not licensed professionals, but are instead graduate and doctoral students, and honestly are not equipped or capable of dealing with our veterans who have such mental health disorders. Our veterans deserve the best care from the most qualified professionals. I'm proud to sponsor this bill. I'm very grateful to Ranking Member Boss for his support as an original co-sponsor. It's also sponsored by the Student Veterans of America. I appreciate everyone on this committee's consideration of this vital legislation, and I urge its considerations for passage. Thank you, Madam Chairman. I'll yield back.
Thank you, Congressman Murphy. Before we move on, would any members of the subcommittee like to comment on any of the bills on the agenda today? If not, we will move on to the second panel. And I'd like to introduce our second panel from the Department of Veterans Affairs. Testifying before us this afternoon is Mr. David Perry, Chief Officer for Workforce Management and Consulting within the Veterans Health Administration. He is accompanied by Mr. Mike Fisher, Chief Officer of the Readjustment Counseling Service within the VA, within the Veterans Health Administration. Welcome to you both. I will remind both of you to please pause at 2 to 3 seconds before speaking so that the recording will capture everything that you say. Your written statements will be included in full in the hearing record without objection. And Mr. Perry, I now recognize you for 5 minutes for VA's remarks on the bills before us today. Thank you, Mr. Perry.
And good afternoon, Chairwoman Brownlee, Ranking Member Bergman, and members of the subcommittee. Thank you for inviting us here today to present our views. Joining me today is Mr. Michael Fisher, Chief Officer, Readjustment Counseling Service. We appreciate the committee's continued interest in the important issues covered in today's agenda. While there may be technical issues, as expressed in our written testimony, that we'd like to work with you on, VA supports several bills: Build a Better VA, Veterans Preventive Health Coverage Fairness, CPE Modernization, Assistance for Family Caregivers, and the VIPER Act, which VA strongly supports. For the other bills, VA strongly supports the goals, but very similar efforts or programs are already underway, or there are other issues that have raised concerns. I won't be able to cover each bill in depth during my oral statement. Today, I would like to focus my attention on the bills addressing VHA's hiring practices, vet centers, and the caregiver program. I'll begin with the Veterans Improved Access to Care Act of 2021. Currently, VHA's existing onboarding goals are faster than the goals proposed in this bill. Additionally, some provisions of this proposed bill, namely Section 2A and 2C, are already enacted into law. The new information about time to hire is reported in the most recently quarterly VA Mission Act 505B report. VHA is currently averaging 62 days to onboard Title 38 positions and 45 days for hybrid Title 38 positions, for an overall average of 51 days. Exceeding the goal proposed in this draft bill. As proposed, this bill will not assist VA in improving time to hire. For these reasons, VA does not support this bill. Next, the Vet Center Support Act. VA is committed to identifying and reaching all individuals and their families who meet the eligibility criteria for vet center services. VA understands that the intent of the proposed legislation is to support vet centers by ensuring services and resources are available for eligible individuals in each state. However, the congressional report on vet center services and resources that would be required by this legislation appears to be redundant with the congressional reports required of VA under existing legislation. Currently, VA reports to Congress through the following mechanisms. VA is required to submit an annual report on the activities of the Readjustment Counseling Service. This report includes a prediction of trends, analysis of demand and unmet need, and workload and additional treatment capacity. Additionally, House Report 116-445 directs VA to report to the Committees on Appropriations to both houses of Congress on the vet center services and outreach conducted by VA in each state or U.S. territory that does not have a vet center located within its jurisdiction. Next, a bill to amend Title 38 and furnishing vet center services. The timeframe associated with review of this proposed legislation does not adequately allow VA to conduct a thorough assessment on how the proposed expansion of eligibility would impact delivery of vet center services, access to services for existing eligible individuals, and budgetary considerations associated with these changes. The mission of RCS is to provide readjustment counseling services to eligible individuals who have military service-related trauma, served in a combat zone or area of hostility, or were activated in response to a national emergency, major disaster, or civil disorder. As written, the bill proposes to expand eligibility solely based on the individual pursuing education using covered educational assistance benefits, and may result in individuals seeking services that fall outside the focus areas of vet centers and present significant challenges to the therapeutic environment for those already receiving vet center services. For these reasons, VA does not support this bill. And finally, a bill to amend Title 38 to improve the program of comprehensive assistance for family caregivers, or PCAFC. VA strongly supports the draft bill and recommends that Congress take action to ensure it's a timely enactment. The draft bill would, among other things, clarify that decisions under PCAFC may be appealed only through VHA's clinical appeals process. It would make it clear that such determinations are not subject to Board of Veterans Appeals review. However, VA welcomes the opportunity to provide technical assistance, including the technical assistance included in my written testimony, to eliminate any possible confusion as to the effect of the bill language. By clarifying that PCAFC decisions are only reviewable through the VHA clinical appeals process, the draft would ensure that PCAFC decisions remain within the purview of clinical providers, and that decisions concerning a patient's healthcare and treatment are made by medical professionals with appropriate training and expertise. For those reasons, we cannot support these bills in their current form. I want to stress, though, however, we share many of the laudable goals of these bills, and we'd be glad to work with the committee to mitigate concerns where we have them. This concludes my statement, Madam Chairwoman. We are happy to answer any questions you or the other committee members may have.
Thank you, Mr. Perry. And I will now recognize myself for 5 minutes of questioning. Again, we really appreciate you being here. And last month, the full committee held a hearing on the topic of VA infrastructure. We briefly discussed my bill at that hearing, Build a Better VA Act. And at the time, the department said it had not taken a position on the bill. So I appreciate you taking a deeper dive and supporting it. This has just been a long-standing challenge. It's a bill that I've carried for a very, very long time. It shouldn't take an act of Congress to lease a facility, and certainly the way the CBO scores these leases over the full life cycle of the lease, may it be 20, 25, 30 years, has made it absolutely prohibitive in terms of moving forward with leasing facilities. And as this committee and the full committee have discussed many, many times, we need the flexibility and the nimbleness of the VA and its facilities to really meet the needs of veterans where they are. As cohorts of veterans move around the country, we need to be able to adjust. So I feel as though this particular legislation is really critical to advancing VA healthcare to our veterans in a timely way. So I'm curious in terms of what your recommendation is to change that threshold from $1 million to, I think, roughly $3.1 million per year. So can you tell me how this would affect the number of leases that would still be subject to authorization through committee resolution? You know, it's my understanding, staff has told me it's 21 leases outstanding over the course of 4 years. Can you tell me how we'll attack those 21 leases with your recommendations on the bill?
Thank you, Chairwoman Brownlee, for that question. We agree. The threshold that we're looking to increase, the 1 million to just over 3 million, really brings us in alignment with other federal agencies and matches what GSA actually does. And that consistency across government is what we're looking to gain parity with. And so by virtue of increasing that amount, it will actually give us flexibility to provide those leases more rapidly, which of course would lead to increased services and care for our veterans. So the additional time that, as you know, to obtain leases authorizations has a direct impact on our veterans. And so by increasing this threshold, will have us actually be able to move quickly and act on those leases that you currently mentioned.
But in terms of the 21 leases out there, do you have any idea how, if your recommendations to the bill became law, how many of those leases would we capture? How many would still take an act of Congress?
Yes, ma'am. I don't have those amounts in front of me, but I'd be happy to take that for the record to give you specifics on exactly which one of those leases would be immediately able for us to act on and which ones would still require full legislation to get through.
Very good. And I guess the other comment that I would just make while I have the opportunity to be on this topic is, you know, if you look at the skip list now of all the facilities that is a priority for the VA, and skip really requires, areas meet a certain criteria before they even get on the skip list. So, you know, there are 21 leases out there, but there is an inordinate amount of other facilities that would be sort of brick and mortar building. And I just personally believe that the VA has to take another look at that, because I think we do want to have this flexibility and nimbleness within the VA. I think leasing gives us those opportunities. I think it will save money in the long run and better serve our veterans. So, my suggestion to you, I don't know whether you agree with me or not, but my suggestion would be to take another hard look at that skip list and see where we could move from brick and mortar to a leasing environment. And I say that because I think we'll get through more of those facilities and meet the needs of veterans. So if you have a comment, I have about 16 more seconds.
Thank you, ma'am, for that comment. And we agree. We recognize that the point of care is changing, and we need to be able to agilely change where we deliver that care. And this lease improvement will give us that opportunity to provide more nimble care, as you suggested. So we are in support, and we agree with your comments.
Thank you. Thank you very, very much. I appreciate that. I now recognize General Bergman for 5 minutes of questioning.
Thank you, Chairwoman Brownlee. And Mr. Perry, I'm a little bit confused by VA's testimony regarding the draft bill to require an independent assessment of the VA healthcare system every decade. Your testimony states that the department opposes the bill in part because it would interfere with VA's day-to-day operational efficiency. Could you please explain to me how VA determined that daily operations would be so significantly hampered by an assessment performed by an outside entity once every 10 years?
Thank you for that question, General Bergman. I'm going to ask my colleague, Mr. Fisher, to address that question.
Thank you, Ranking Member Bergman, for that question. I think there's a couple of reasons for that. The first reason is that staff currently is dealing with existing reviews, whether that is one-off, such as what you brought up with the Mission Act, as well as ongoing reviews from the OIG, GAO, as well as the Joint Commission. In addition, with the staff concerns, is that there is a large amount of effort to spin up those contractors when they come on, making sure they understand the data. So there's that interaction that VA has concern with.
So what I heard you say was some prior planning. It's one thing to have a surprise inspection where nobody's ready for it because they have their day-to-day ops going on. But I would suggest to you, I would like to continue the dialogue with the VA to say, okay, if we plan something far enough in advance, so there's no surprises. And, you mentioned the key phrase, spinning up outside contractors. I would suggest to you that's probably an antiquated way of doing business. So we don't need to continue to do that. I've seen a lot of that in other agencies. So I look forward to working with you on how we can best implement this and both figure out a way that, because once a decade in the digital world is almost like, once a year or two, with the rate of change of everything that we're doing. So, Mr. Perry, can you elaborate on the department's concerns regarding the detrimental impact that the Bodette decision could have on VA's family caregiver program and the concerning precedent it could set for other VA clinical decisions?
Yes, sir. Again, I'm going to turn to my colleague to address that question regarding that program.
Excuse me. Yes, I'm sorry, Ranking Member, can you please repeat that question?
Yeah. Basically, you got the Bodette decision and what could be the detrimental impact that could have on the VA's family caregiver program and concerning the precedent it could set for other VA clinical decisions.
Absolutely. And thank you for that question. The concern with that decision really is centered around who will decide those appeals, whether it is the appeals board on the benefit side of the house or how VA interprets the original intent from Congress was making sure that is a clinical decision. Having that decision go through the Board of Appeals, it's further away from the veteran, the caregiver. It also does not take into account the multidisciplinary decisions that were made within those clinical providers.
Okay, well, you know, if the draft bill regarding the family caregiver program were to be enacted, how soon do you think that the VA could complete the second and final phase of expansion for the family caregiver program?
If the draft bill is approved, we should be on target for that, the date that's added to that. There is some concern as we continue to standardize and consolidate how we do work. So if actually I could take that for the record, just to make sure that we can give you accurate information.
Okay, and I got 25 seconds and you can take this next one, this last one for the record. Would the VA support expanding the report that would be required by the draft bill regarding family caregiver program to include an accounting of all denials, not just those due to the best medical interest criteria? You know, and again, my time is up here, but I'd like to, for the record, why or why not you would support that. And with that, Madam Chairwoman, I yield back.
Thank you, General. Congressman Levin, you are next for 5 minutes of questioning.
Thank you, Chairwoman Brownlee. It's good to be with you. Thank you for holding this hearing. Mr. Perry, it's nice to see you. Thank you for all your good work. I did want to turn to an area of some disappointment, and that's specifically that VA was unable to implement the first phase of caregiver program expansion by the deadline that Congress established in the Mission Act. I've heard from a number of VSOs who, for lack of a better term, are anxious for VA to implement the second phase. So I'm glad that General Bergman's bill would allow VA to accelerate this process. We've got to move forward as expeditiously as we can while ensuring that the program has the necessary staffing, necessary IT infrastructure in place to effectively serve veterans and their caregivers. What gaps remain in VA's ability to fully expand the caregiver program, and what plans do you have in place to quickly address them?
Thank you, Congressman, for that question. Again, I'm going to turn to my colleague, Mr. Fisher, to address that question.
Thank you again, sir, for that question. I think the first gap is making sure that we have the ability to expand the caregiver program widely to all eras, as well as adjusting the date on when we can implement that next phase. Once some of the work that we are doing within that particular program office, like we said before, starting in October of last year, we begin to standardize, streamline, make sure that we have consistent processes to be able to deal with these decisions, as well as working with different program offices such as the Veteran Experience Office, the patient advocate, to make sure we're communicating effectively to veterans and their caregivers the results of those decisions.
Thank you for that. I understand that approximately 5,800 applications in fiscal year 21 were denied due to the veteran's injury being within the service states that will not be eligible until the phase 2 expansion. Are you informing these veterans that they may soon be eligible, and do you have a process in place to automatically reconsider their applications?
So if I can take that for the record to be able to make sure we're providing you accurate information.
Thank you. We'll look forward to circling back with you on that. Back to the bill, it would also clarify that caregiver program eligibility decisions are subject to VA clinical appeals processes, which involve contacting the local facility's patient advocate. Unfortunately, what we've heard several times is veterans not being called back in a timely manner. And I think I'm concerned that high workloads could be contributing to these delays. You probably know in 2018, VHA issued a directive updating policies and procedures for its patient advocacy program, including a requirement that each VA medical facility have at least one patient advocate. However, it was recently brought to my attention that in some cases, VA has fulfilled this requirement by assigning the same patient advocate to multiple facilities. My question is, what safeguards does VA have in place to ensure that patient advocates have appropriate workloads and are actually responding to veterans in a timely manner?
Once again, thank you for this question. And I think I go back to what we stated before, and that is that program office is working to create consistencies and standardization to be able to help deal with those issues. Veterans should not go without answers. I think that also speaks to the partnerships that they are working with the different program offices to ensure they're communicating effectively. I would like to take the portion about the hiring practices for the record to be able to get you accurate information on what's happening with that.
All right, well, we'll certainly be circling back with you on that as well. Mr. Perry, did you have anything that you wanted to add on either of my second or my third questions there?
Yes, sir. Thank you. I agree with Mr. Fisher's comments, and for those responses that we weren't able to get to you today, we will follow back up for the record to make sure we provide that information.
All right, we'll look forward to that. And with that, I'll yield back and thank you again for your service to our veterans.
Thank you, Congressman Levin. Congresswoman Radewagen, you are next you have 5 minutes for questioning.
Aloha, and thank you, Chairman Brownlee and Ranking Member General Bergman for holding this hearing today. Special talofa to Chairman Takano as well. Thank you to the witnesses for your testimony. Mr. Perry, please elaborate on how HR 2797, the National Green Alert Act of 2021, might be stigmatizing for veterans with mental health conditions. And Mr. Perry, on our next panel, the Minority Veterans of America will testify that HR 2797, the National Green Alert Act of 2021, is duplicative of other existing alert systems for vulnerable adults. Do you agree? And why or why not? Mr. Perry.
Thank you, Congresswoman, for those questions. I'll start with the first one. We do have some concerns with the stigmatizing that could impact our veterans. As this proposal is currently written, it portrays veterans that they would be incapacitated in some way, which is actually an unfair label for veterans with those mental illnesses. Currently, individuals with mental illness have the right to refuse clinical care in context, so as long as they're not in danger to themselves or others. So there must be significant evidence and evaluation, and sometimes often through court action, to endorse the ability for an individual person with any medical or mental health decisions on their behalf. So as currently written, this proposal actually impinges on the individual rights or denied care a veteran or individual may have. With respect to the other alert systems, we do follow those. And so there are, as you know, Amber Alerts and other type of systems that we do use, as well as welfare checks. And so all of those are common practice. And we also engage with our community emergency response partners to seek support for individuals that are in mental health crisis. So we believe our current systems, along with those other alert systems that are already in place, actually accomplish what this bill intends or sets out to do. That's not to say there isn't merit in the Green Alert Act. I think we would like to work with the committee on exploring and making sure that we meet the intent of that alert system, but also to make sure that we don't disenfranchise any of our veterans that are suffering from mental health illness.
Thank you, Madam Chairwoman. I yield back the balance of my time.
Thank you very much. Congresswoman Underwood, you are now recognized.
Well, thank you, Madam Chair. And thank you again for including my Veterans Preventive Health Coverage Fairness Act in today's legislative hearing. For over a decade, private health plans have been required to cover preventive services without charging out-of-pocket fees. The same is not true for veterans' healthcare coverage. We know that barriers to accessing preventive care can leave individuals vulnerable to serious health conditions and complications, because people who cannot access recommended immunizations are at risk for vaccine preventable diseases. Women who miss their mammograms might be living with undetected breast cancer that becomes more dangerous every day that it's left untreated. And adults who can't access screenings for depression continue to suffer in silence without getting connected with the treatment and care that they need. While VA's health benefits package includes some preventive services, there's no overarching prohibition on cost sharing for preventive services for veterans receiving care through the VA, even though this is a common sense prohibition that already exists for most civilians through the Affordable Care Act. Mr. Perry, does the VA have a clearly defined list of preventive services that are available to veterans without any form of cost sharing?
I thank you for that question, Representative Underwood. I certainly appreciate it. And we do have that list. I would like to take that for the record to give you the specific breakout of what we do actually already cover under our current legislation. And I'll turn to Mr. Fisher to make sure I didn't miss anything, or if he has anything to add to this as well.
No, ma'am. Nothing to add. Other than currently right now, actually, no, there's nothing else to add, excuse me.
Okay, Mr. Perry, what steps is the VA taking to ensure that veterans know which preventive services are available to them without cost sharing?
Thank you for that question as well. And I'm going to ask Mr. Fisher to give you the details on that.
Ma'am, we'll have to take that one for the record as well to make sure that we're giving you accurate information.
Okay, do you all know what criteria the VA uses to determine which preventive services will be offered without cost sharing?
Yes, ma'am. Currently, we do not have to, there is no copay requirements for preventive screening, immunizations, laboratory services, and other type of things like radiology services and electrocardiograms.
Right, but what process do you use to determine what goes on that list?
That I am unaware of, and I want to make sure we get you accurate information.
Okay, please. And then finally, what extent is the VA tracking utilization of the preventive services among veterans? And is that tracking disaggregated by services for which the department charges out-of-pocket costs compared to the services that a veteran can access for free?
There is tracking through our corporate data warehouse. As far as how that is disaggregated, we will have to take that for the record as well and make sure we get back to you with accurate information.
Okay, what I would like based on this conversation is just to summarize for folks, we're looking for the list of preventive services, how you're communicating that list to the veteran, the criteria you use to determine what gets put on that list of services offered without cost sharing, and then the utilization data that you are tracking, and would love if you could disaggregate that for us when you transmit it over to our office. Thank you so much for your time and appearing before the committee today. Madam Chair, I yield back.
Thank you, Congresswoman. I now recognize Congressman Rosendahl for 5 minutes of questioning.
Thank you, Madam Chair. I've got several questions here. Mr. Perry, in regards to the VA Quality Healthcare Accountability and Transparency Act, please describe the work that the VA is doing with the DoD, CMS, and others to, quote, harmonize the entire process of quality measurement and recording, end quote, and how, if at all, that work is duplicative or contradictory to HR 2775, the VA Quality Healthcare Accountability and Transparency Act?
Thank you, sir, for that question. And you are correct. We do feel that a majority of that bill is duplicative in nature, especially with the quality measures that are already in place and that we publish on our Access to Care website. The actual quality monitoring provision is redundant with Section 104 of the VA Mission Act. So that's where our comments regarding the duplication comes from. Additionally, along with some other concerns we have with 2775, the bill directs us to actually post staffing and vacancy information, which again, this is also a requirement under the VA Mission Act. And that data is readily available in that 505 report that I mentioned in my opening statement. We actually publish that quarterly and annually. And so we believe that data is already there. To answer your other question, sir, with respect to the provision to make websites easily understandable, we agree that we need to do that. But we also believe that, a statutory mandate for website content really needs to be thoughtfully and carefully considered. Based on our research and our experience, that's taught us that solutions intended to kind of serve all possible audiences often don't serve any of them effectively because we're trying to do too much in a universal listing of data and quality. And so we would like to work with you and the committee to further explore how we can provide better quality and easily understandable data to the public.
So are you working with the actual participants to identify exactly what data is necessary, what is working well for them, what their demands are, like a regular business, customer service? What are your customers demanding, and can you put that together and share it with us?
Yes, sir, we certainly can, and we can bring that back to you. I think we are looking at that feedback we receive from our customers to make sure that the intent of what we publish and we're actually producing as far as our data quality does meet the intent of what our customer base is looking for. So we'd be happy to share the work that we're doing with those other entities that you mentioned so that you have a clear picture of what we're already working on.
Very good. So in regards to the Veterans Improved Access to Care Act of 2021, your testimony regarding 3027, the Veterans Improved Access Care Act, states that, quote, the existing onboarding goals are faster than the goal proposed in this proposed bill, end quote. What are VA's existing onboarding goals, and how often does the department meet them?
Yes, sir. Thank you for that question. So we actually have two models for our time to hire. We have an 80-day model for our administrative or our Title V positions. And then we have a 100-day model for our clinicians or our Title 38 and hybrid workforce. We actually measure the timeline from the starting clock for us is the need validated. So once we verify that a vacancy or position has been validated, we need to recruit, that starts our clock for us. This specific piece of legislation in 3027 starts the clock well in advance. It's actually at the tentative offer state. So there's a lot of steps that actually happen as precursors before we get to the tentative offer. And so our models are aligned to track that entire time. And as I said in my opening testimony, for our hybrids and our Title 38 workforce, we're actually averaging 51 days to hire those positions, which is well in line with our metrics.
You're muted, Congressman Rosendahl.
Sorry, thank you very much, Madam Chair. So if the bill were amended to match VA's current onboarding goals, would VA support that bill?
Thank you, sir. I think that's something we would like to work with you on. I think we have the established timeframes now that are approved through the Office of Personnel Management. So we want to make sure get clarity on what legislation would actually do to actually increase or improve our existing metrics that have been approved by OPM.
Thank you. And I am certainly close enough to the edge, Madam Chair, that I would yield back.
Thank you very much. And Congresswoman Miller Meeks, you are now called upon for 5 minutes of questioning.
Thank you very much. Hopefully I'm unmuted. Thank you so much, Chairwoman Brownlee. One of the bills we are discussing today is HR 3693, the VA CPE Modernization Act, which I am proud to co-lead with the chair. And I'd like to take a moment to thank Chairwoman Brownlee for her leadership on this bill. It is especially important to me, both as a 24-year military veteran and as a doctor, to provide more resources to those who are tirelessly working to care for our nation's veterans and who want their professional education continued. Our bill would increase the professional education allowance for VA healthcare professionals for the first time in 30 years. This bill would increase the amount provided to physicians and dentists at the VA from $1,000 to $4,000 per year, and would provide, for the first time, $2,000 per year to nurses, psychologists, physicians assistants, and other types of clinicians at the VA. This common sense bill would ensure that all clinical employees at the VA facilities are able to continue their professional education. And as we know, this is also one of the continuing education is also necessary for relicensure. It's one of my top priorities to care for our veterans and ensure that they have the best treatment possible, not just now, but also for the future. I would also like to take a quick moment to thank Representative Banks and Pappas for introducing the National Green Alert Act, which I proudly co-sponsor. The National Green Alert Act would raise awareness similar to the Amber and Silver alerts if a veteran with a mental illness has gone missing. I support this bill. I passed a similar one in the state Senate in Iowa, and I encourage all my colleagues to do the same. It's interesting listening to this conversation about the VA workforce and bringing on individuals. And so, Mr. Perry, I have the unique skill set, if you will, as being a doctor, to have actually applied for a job at the VA 6 years ago when I ended my work as the director of the Iowa Department of Public Health. And so when you're talking about onboarding, expediting that process, streamlining the process of hiring, I will let you know that in applying for that job through USA.jobs.gov, that I was already 6 months into another job by the time I even heard back that I was being considered for the job at one of the VA hospitals as an ophthalmologist. There were several of them. So to hear that right now that you're starting the clock in advance of the actual negotiation process and that it's 51 days to hire, that's certainly much more in alignment, because I can tell you as physicians, they're not going to wait 6 months, much less 3 months, to hear back from you if they're even eligible for a position. And I was applying not only as a doctor, and there were several ophthalmology positions opening, I was also applying as a military veteran. So I'm going to say thank you for that. You also mentioned in your testimony that the VA CPE Modernization Act would help address clinical mission critical shortages. And I just wanted you to, if you could explain how the bill would do that.
Thank you, Congressman, for your comments and your questions. First, let me state that we have come a long way, I think, in our recruitment. And I'm certainly apologetic to hear that it was your experience when trying to come work for us. I hate to hear that from anyone, especially a valued clinician. So thank you for going through that. With respect to the question you asked, I think we recognize, as long as you, that CPE is actually a powerful recruitment and retention tool. And we think that this expansion will actually help us in that area and bring us more into alignment with what private sector does for their CPA and their clinicians. So we're excited for this piece of legislation. We think it's going to make a tremendous difference, not only in our recruitment, but more important in our retention. As you stated, we know that it is much easier to retain than it is to hire and bring people in the door. So we're looking forward to this increased flexibility to do exactly that, help with not only our recruitment on the front end, but also the retention and the professional development of our workforce, because we know also that a better educated workforce is going to give us better outcomes and better delivery of patient care.
In that same vein, do you think that it will also improve the quality of the clinicians that you can both recruit and retain?
Yes, ma'am, we do, because I think by expanding the cost that we can cover, it will lead to, I think, hopefully additional CPE that an individual can take and not just be limited to a very small threshold. And that we know the cost for professional training continues to increase along with everything else. So we absolutely do believe that it will lead to a better professional and better educated workforce.
Thank you so much, Mr. Perry. And thank you, Chairwoman Brownlee. I yield back my time.
Thank you, Congresswoman, and thank you for partnering with me on this bill. I think you're the best partner I could possibly have on it, given your background, and I think it's an important bill. And I can tell you that for years the VA has testified in our committee saying that this program needs to be looked at. The capping of the fees right now never cover the costs. People don't utilize it because of that. And in terms of retainment, the VA has overwhelmingly testified that they believe improvement in this program will help in recruitment and retainment. So thank you very much. And my understanding, Congressman Mervan and Congressman Murphy, that neither one of you have questions. Is that correct? And I don't see Congressman Murphy on the screen, so I presume I have correct information. So with that, we will, without any further questions, we thank the panel for your testimony today. And certainly, Mr. Perry, Mr. Fisher, you are welcome to remain on Zoom to listen to the VSO testimony if you like. Otherwise, you are certainly free to go. So we will move right along to the third panel. And we are pleased to have representatives from 3 veteran service organizations with us today. Your insights on these pieces of legislation are invaluable, always. We also thank you for your ongoing work to support our nation's veterans and our nation. And you are proof that service continues after military service. So our witnesses are Mr. Marquis Bearfield, Assistant National Legislative Director for Disabled American Veterans, Mr. Andy Blevins, Operations and Policy Director for Minority Veterans of America. I believe, Mr. Blevins, this might be your first time testifying in front of the committee, so welcome. Ms. Tamley Bartlett, Deputy Director of National Legislative Service for the Veterans of Foreign Wars. So again, I'll just remind you again, that little pause before speaking so that we capture everything. Your written statements will be included in full in the hearing record without objection. And Mr. Bearfield, we begin with you. You're now recognized for 5 minutes for remarks on the bills before us.
Thank you. Chairwoman Brownlee, Ranking Member Bergman, and members of the subcommittee. Thank you for inviting DAV to testify at this legislative hearing and offer our views on the bills under consideration. My full written statement covers all the legislation, but I will just highlight a few bills in my oral statement. DAV strongly supports H.R. 913, the Build a Better VA Act. The bill would allow approval of major medical leases through a committee resolution rather than enactment of a law. This would properly continue congressional oversight while avoiding unworkable pay-go rules that have prevented and delayed the leasing of urgently needed VA healthcare facilities. Another bill that DAV strongly supports is H.R. 3452, the Veterans Preventive Health Coverage Fairness Act, which would add preventative medications and services to the list of no-fee treatments that VA covers and eliminate co-payments for veterans. In contrast, these same preventative medications and services are provided to service members, military retirees, and many civilians for free through military and private health insurance providers. DAV believes that asking veterans to pay for part of their benefits is contrary to the spirit and principles underlying those benefits, and passage of this legislation would be another step towards ending co-payments. DAV is also pleased to support the VIPER Act to ensure that VA maintains its commitment to a robust research endeavor within the department. This legislation would make a number of changes to strengthen VA research and IT needs, including authorizing resources to help address longstanding research infrastructure needs, and establish a new career development award grant for universities with smaller research programs. Likewise, we are pleased to support 2 bills to strengthen VA's vet centers. H.R. 3674, the Vet Center Support Act, would require VA to submit a comprehensive assessment of VA's capacity to provide robust mental health and readjustment counseling services, and then report on the feasibility of increasing staff and establishing new vet centers to help fill gaps in coverage. DAV also supports the draft legislation that would expand eligibility for readjustment counseling and related mental health services at VA's vet centers for veterans or service members receiving educational assistance benefits. As strong supporters of VA's vet centers, we believe these bills would strengthen the program and help many additional veterans. We would also ask the subcommittee to consider adding provisions to ensure funding levels are commensurate with the expected growth in demand for vet center services, increases in staff, and outreach efforts by vet centers that may be necessary. Madam Chairwoman, DAV strongly supports the draft legislation to authorize VA to begin the second phase of the caregiver program expansion sooner than next October. Unfortunately, when VA failed to implement caregiver IT upgrades a couple of years ago, both phases of expansion were pushed back a year. This draft legislation would allow VA to move ahead with the second phase of the expansion and provide thousands more veterans and family caregivers the support they need. Further, we recommend that VA be required to report to Congress within 30 days and then every 90 days thereafter, whether it intends to begin phase 2 sooner than October 1st, 2022. And if not, the specific reasons why and what resources it would need to move forward. DAV supports quarterly reporting on applications denied due to the basic medical interest criteria. However, we recommend that VA also be required to regularly and publicly report on all denials, reassessments, removals, and appeals. We do not support subsection A of the bill that would prohibit veterans from appealing denials by VA for the caregiver program, a right that was recently upheld by the Court of Appeals for Veterans Claims in the Bodette decision. Allowing the board to play a role in reviewing caregiver decisions would help to increase confidence in the fairness of VA's decision-making process among veterans and caregivers and likely reduce appeals. Madam Chair, this concludes my remarks, and I welcome any questions that you or members of the committee may have.
Thank you, Mr. Bearfield. Next, I'd like to recognize Mr. Blevins for Minority Veterans of America's testimony. Mr. Blevins?
Yes, ma'am. Thank you so much. Chairwoman Brownlee, General Bergman, and members of the committee. I am a Navy veteran, a patron of VHA services, and I am proud to serve as the Operations and Policy Director for the Minority Veterans of America, an entity that works on behalf of 10.2 million of our nation's veterans with a broad array of identities, orientations, experiences, and concerns. Thank you for allowing me to contribute to today's hearing. We've been proud to provide support for much of the legislation that was brought forward for discussion today, looking towards effective oversight and approval processes, addressing the incongruent access to comprehensive physical and mental health care among differing classes of veterans, and ensuring independent assessments and research are carried out for the benefit of departmental programs will have a significant impact on our community. The centralized placement of information in a public and easily accessible format is essential for veterans to make informed decisions about their own care, for veteran service organizations to better advocate for their respective communities, and for this legislative body to provide due and necessary oversight for the department. The VA Quality Healthcare Accountability and Transparency Act will have an enormous impact on outside actors, patients, and care teams. Within the minority veteran community, metrics relating to quality of care and safety are likely to be of the utmost importance. Though the department has taken extraordinary measures to continue increasing the provision of quality care, many in the minority veteran community have expressed a continued lack of confidence and distrust in VA systems. Heightened transparency is a strong step towards repairing those broken community connections. We applaud Congressman Gallego for his dedication to heighten data transparency and would only urge that the available data sets include any ethnic, socioeconomic, and minority indicators that the department may collect, and to ensure that the data sets are easily searchable. I would also like to specifically highlight the National Green Alert Act. As Congresswoman Radowagen mentioned, while well-intentioned, we find that this piece of bipartisan legislation's focus is redundant and limited in application to an extent that the program would entirely neglect a population that is most in need of the benefits that this program can provide. I'm speaking of individuals like Vanessa Guillen, Gregory Morales, Aaron Robinson, Freddie De La Cruz, and many other siblings in arms that may have benefited from a similar program. Congressman Pappas's legislation has the potential to ensure that this type of injustice does not happen again. We would urge that this bill be re-examined to leverage existing programs like the Ashanti Alert and national partnerships with other sovereign nations, and to work with each branch of our armed services to provide inputs on the feasibility and best practices of incorporating actively serving individuals into the proposed framework, a practice that has been successful in Texas's Camo Alert for missing service members and veterans since 2019. Intersectionality has become a buzzword that holds different meanings amongst different groups. However, it is important that we collectively understand that intersectionality is more than a value. At its core, it is an analytical strategy and a critical praxis. It is an organizing principle with which we can negotiate innate yet disparate societal changes while continuing to center the lived experiences and needs of minority veterans. The number of minority veterans is projected to rise to 32.8% by 2037, making attention to minority veterans a key issue for veteran public policy. In advocating for my community, which my organization defines as racial and ethnic minorities, women, LGBTQ people, and religious minorities, a primary issue has been confronting policy approaches that seek to maintain or amend existing institutional structures and processes, or to entirely create new ones that add in minority veteran concerns after the fact. This approach foregrounds the needs and experiences of majority veterans in designing and implementing policy at the expense of the unique needs of minority veterans. This creates barriers and perpetuates harms through initiatives that are often well-intentioned, but nevertheless miss the mark. On behalf of my community, I would like to extend my sincerest appreciation for the attention that this committee has paid to the role that intersectionality plays within the veteran community. An unprecedented and markedly difficult venture, given the diverse genealogy of the concept and its variety of methods and applications. Thank you again for the opportunity to testify before you today. My team and I look forward to continuing to work with your offices, and I'm happy to answer any questions you may have.
Thank you, Mr. Blevins. And finally, we'll hear from Ms. Bartlett from the Veterans of Foreign Wars. Ms. Bartlett.
Chairwoman Brownlee, Ranking Member Bergman, and members of the subcommittee. On behalf of the men and women of the Veterans of Foreign Wars of the United States and its auxiliary, thank you for the opportunity to provide our remarks on these important pieces of legislation pending before this subcommittee. The VFW's views on all 12 bills can be found in my written testimony, and I will take this opportunity to highlight just a few. Air Force Reserve veteran Corey Adams went missing in the spring of 2017. He suffered from PTSD for many years, and his family knew something was amiss and went to the police to file a missing persons police report. The police investigation did not begin until 8 days later, and the veteran's body was found 18 days after he went missing. In 2018, members of the VFW Department of Wisconsin, along with Corey Adams' family, were in attendance as the governor signed into law the Corey Adams Searchlight Act, which created the statewide Green Alert system. Similar to the Amber and the Silver Alert, the Green Alert notifies the public if an at-risk veteran, active duty member, or National Guard or Reserve member has been reported missing. Since its implementation in Wisconsin, 24 alerts have been issued. All but 2 individuals have been found and returned home safely, which is a 92% success rate in that state. The VFW strongly supports HR 2797, the National Green Alert Act of 2021, which would establish a committee to create a toolbox of best practices, procedures, and other details so states may implement their own version of the Green Alert system, so no family will have to sit idle and wait for their loved one to return home safely. Vet centers are VA's most unheralded program that has been around for 42 years. Over 300 centers, 83 mobile units, and several outside and community access points serve eligible veterans and their families. This past January, 2 mobile vet centers deployed to Capitol Hill to be a vital resource for Guardsmen, Capitol Police, and congressional staff. Most recently, a mobile vet center was sent to the location of the deadly Florida building collapse to provide support services for veterans and non-veterans. The VFW supports HR 4233 and HR 3674 and urges Congress and VA to be mindful that resources and staff of the vet centers are not pushed to the limits with the new eligibility expansion. Student veterans face unique challenges beyond their schoolwork. And according to the latest National Veteran Education Success Tracker report, the majority of the veterans who complete their degrees are non-traditional students. And almost half of those students are parents, and half of them are married. In addition to pursuing their degrees, the responsibility of securing childcare and providing for their families leaves little time for the veterans themselves. The American Psychology Association released a study stating nearly half of student veterans have had suicide ideations, and 20% have planned to follow through with those ideations. Expanding eligibility to VA vet centers to include certain veterans and members of the armed forces who are using their education assistance benefits gives added mental health support during this exciting but often stressful time. In regards to the bill draft to amend the caregiver program, the VFW cannot support the bill draft as written. We caution against setting into law the pathway that would sacrifice due process by removing a veteran or caregiver's redress of grievance. The caregiver appeals process must not end at the clinical decision. There must be another appellant option available. However, we do support opening the phase 2 application process sooner. The phase 1 rollout face delays that VA believes should postpone the opening of phase 2. The VFW disagrees. Congress must hold VA accountable to opening phase 2 of the application process sooner and not later than the 2 years from the Secretary's certification date. Phase 2 veterans and their caregivers have been patiently waiting their turn for far too long. Finally, the VFW supports HR 913, Build a Better VA Act, which would bring flexibility to the lease funding for VA. By changing funding appropriations, VA would have more leasing options, which would make the leasing process easier. VA capital infrastructure was changeless for years, and this would be a small step in the right direction to alleviate some of this infrastructure issues. Chairwoman Brownlee, Ranking Member Bergman, this concludes my testimony, and I'm prepared to answer any questions you may have.
Thank you very much for that. And we will move on to questions, and I'll now recognize myself for 5 minutes of questioning. My first question is really to all of you, regarding this issue around the second phase of the caregiver program. And I'm really just, I'm sort of curious to know how frequently you're hearing from your veterans calling in, veterans who are confused about the program. If you could just talk a little bit about that. I mean, I support your comments about the second phase, and we've had a hearing on that, and we really need to push that forward. But I'm just curious to hear from all of you, kind of what you hear from your folks. So Ms. Bartlett, you want to start?
Yes, thank you for the question, Chairwoman Brownlee. I think the amount of applications that VA has to decline because of those individuals being eligible for the second phase, I think that speaks volumes to the frustration the veterans and the caregivers are seeing with this delay.
Yeah. Mr. Blevins or Mr. Bearfield, any other?
Yes. Thank you, Chairwoman, for the question. Yes, as Ms. Bartlett indicated, the amount of denials that we have seen amongst our members is very high. And then when we talk about the wording in the denials, the denial letters are not very clear as to what the reason or rationale was that they were not accepted when they turned their applications in. So there has to be something done about the language used in those decision letters to make sure that it is very clear as to why the veteran or the caregiver were denied the benefit that they applied for.
Do they in a letter say that they have been denied and they don't have an opportunity, or do they say you have been denied but there will be opportunities in the future?
The letters that I had the opportunity to see just indicated that the benefit was denied, and basically there was no other language used to explain if they had appellate rights, or what was the reasons or bases for the denial. It just indicates that they were not eligible for the benefit, and that was it.
Thanks. Mr. Blevin?
Yes, ma'am. I would just echo Mr. Bearfield. The letters that I've seen are ambiguous, and they don't provide information about the rights.
Great. Mr. Bearfield, on the Viper Act, which is really, all about world-class research and maintaining world-class research within the VA. So can you speak a little bit to the importance of this bill, particularly for your members?
Thank you, Chairwoman, for the question. Yes. The Viper Act would go a long way to helping the research that VA needs, but just needs to go a little bit further to authorize resources to help address the long-standing need for infrastructure concerns as far as lab facilities and regular facilities go, and repairs for life-standing or life safety deficiencies in some of those facilities to make sure that the VA researchers are able to perform their work in a safe environment. Additionally, funding would also allow for the purchase of IT technology that's necessary to improve the Million Veterans Program. So the Viper program would be good once these additional steps have been taken to shore it up.
Terrific, terrific. And of course, why I still have a minute or so left, I want to talk a little bit about my bill, HR 913 on Build a Better VA Act. And I'm sure all of you heard my sort of opening comments about, I think, the need for nimbleness and being able to really meet the needs of veterans wherever they may reside in our country. And I just want to make sure that all of you are in agreement of that, because an agreement to looking at that SCIP list. And I mean, the list on SCIP, I don't know if you've seen it recently, but it is a very, 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 very long list of needs out there that we are not meeting. And if you agree with me that if we begin to lease more facilities, that would give us that kind of flexibility and nimbleness to address more needs within the veteran community. If you could just say, yes, you agree, I'm running out of time.
Yes, I agree.
No,
I think
the
shift in population during COVID has definitely shown us that there has been a shift in the veteran population. So by leasing these properties will definitely help assist that VA along the way.
Great. Well, my time is up. So General, your time has just begun.
Well, I love it when you say that. It looks like I got a whole new lease on life if my time has just begun. So I won't waste any of it. Mr. Bearfield, what concerns do you have with the VA's clinical appeals process that leave you believing really that it is ill-suited to handling appeals for the family caregiver program? And how would you recommend, addressing these concerns? I know we've talked about this, but I just kind of like to, your ideas for making it better.
Well, as indicated in my written statement, if there's a way that those decisions can be elevated to the Board of Veterans Appeals, and the board could be able to use their expertise and help interpret how benefits could be available, or how benefits could be opened up and allow the veteran or their caregiver to be able to get into the program. But before we get to that point, we still need to resolve the issue of the letters that inform them of their denial of benefits. Those letters need to be rectified to fully give a reasons and bases of why they were denied. That way, once the veteran has a full explanation as to why they weren't entitled, that can help them either meet the criteria or get the required items that they need in order to be eligible for the benefit, versus just a letter that's very ambiguous and very frustrating for them.
Okay, thank you. Thank you for your, it's one thing to state a negative, it's another thing to state positives for how we can make things better. So I appreciate that. This is a question for any and all, whether it be Mr. Bearfield, Mr. Blevins, or Ms. Bartlett. the Vet Center Support Act, HR 3674. What, if any, feedback do you receive from your members about vet centers? Do you have any recommendations as to how to ensure that the vet center services could be supported to ensure they are accessible to every veteran who could benefit from them? So again, what can we do? And any thoughts we're not doing that we need to start doing?
I'll start us off on that. Thank you, General Bergman, for that question. As far as the VFW, we've heard many anecdotal stories of our members just singing the praises of the vet centers, that it's a great resource. But unfortunately, there's not enough staff or funding to help support those vet centers. And that's why we support that bill, to help just acknowledge the metrics, the measured outcomes, the needed data, or the needs data of what services the vet center has to offer, and then the need of those communities looking into the vet center, because just useful data will help confirm those stories we hear.
Okay. Anybody else? Mr. Blevins, Mr. Fairfield?
I agree. With additional staffing, it will take away some of the pressures, Ranking Member, that the vet centers are currently experiencing. Their counselors have extremely heavy workloads, and they need more help. And if they can get the funding and resources that they need to have adequate staffing levels, that can help distribute the workload a lot better, and more veterans can be helped in their communities.
Okay, and got about a minute 30 left. Mr. Bearfield, regarding HR 3027, the Veterans Improved Access to Care Act of 2021, your testimony recognizes that VA did a commendable job throughout the pandemic to bring high quality staff into the VA healthcare system. Do you have any thoughts as to how we can help VA sustain that success or like successes?
Thank you, Ranking Member, for that question. Yes, we can, if funding and other incentives for participation are made available. While it's possible that some VA medical centers were able to succeed during the course of this pandemic, but others needed additional resources. So once those staffing levels and resources can be made available, then struggling medical centers or clinics that don't have adequate staffing can be plussed up to make sure that services are available across the board for everyone.
Thank you. With that, Chairwoman Brownlee, I yield back 25 seconds.
Thank you, General. Appreciate that. Congressman Van, you are next in line for 5 minutes of questioning. Mr. Mervan seems to be having some technical issues there, so we will go back to him, and so we'll go to Representative Radewagen for 5 minutes of questioning.
Thank you, Madam Chairwoman and General Bergman. Thank you to the witnesses for testifying today. Mr. Blevins, you testified that HR 2797, the National Green Alert Act, is redundant of Ashanti alerts. Can you describe what those are? And Mr. Blevins, if the National Green Alert System would be studied by HR 2797, and if it's duplicative of other existing alert systems for vulnerable adults, as your testimony suggests, why do you recommend that it be expanded to include those on active duty?
Yes, ma'am. Thank you so much for that question. So we do believe it's redundant of the Amber Alert, the Clear Alert, the Silver Alert, the Endangered Missing Persons Alert, and the Ashanti Alert. Currently, based on our reading of the bill, veterans with mental illnesses will fall into one of those categories. We do believe that there's merit to this bill, like I mentioned in my verbal testimony. Right now, this bill is very much surveillance focused, whereas the Amber Alert, the Clear Alert, those are all support focused. Here, we're reducing a veteran's identity to their mental health. I do think that if we continue to work on this bill and ensure that we focused more on support rather than surveillance, that there would be a lot of merit to establishing it throughout the nation.
Thank you, Madam Chairwoman. Yield back.
Thank you, Congresswoman. And I think Congressman Ravan does not have questions, so we will go to Congresswoman Miller Meeks for 5 minutes.
Thank you, Madam Chair. The question I have is for Tammy Bartlett. Chairwoman Brownlee and I introduced the VA CPE Modernization Act. How will this bill improve the VA clinician workforce, and how would this bill improve the quality of care at VA medical center facilities?
Thank you for that question, Representative Miller Meeks. This piece of legislation will definitely support and expand VA's retention and recruitment. It will also make those other healthcare professionals within VA feel valued by seeing that the VA is willing to help them going ahead and reimbursing them for their CPEs. I myself was a pharmacy technician for 10 years, and being nationally certified, I know the expense of either belonging to an association or having to pay out for those CE credits every 2 years. And by VA doing this, and it just keeps the level of their healthcare professionals above bar and in line with all the other associations that support the fields.
Certainly, being a medical professional, both in nursing and then as a physician, the cost of your continuing education and licensure is significant and has gone up. So I do think keeping pace with currently what it costs to be able to get continuing education and to get relicensed is important. You also mentioned the Green Alert Act, and I am also a co-sponsor of the National Green Alert Act, and I'm thankful to Representative Pappas for bringing this bill forward. In your testimony, you note that my home state of Iowa uses a Green Alert system, and as a state senator, I was one of the people who helped to bring that bill forward. I was a vice chair of the Veterans Committee in the state Senate. I believe that this is a model. Iowa's model is one that can be implemented across the country. How effective have green alert systems been in states that have implemented them, and what can we do to help more states implement these types of systems?
Thank you so much for that question, Representative Miller Meeks. Like I mentioned in my oral testimony, Wisconsin has had a 92% success rate with the green alerts. And as far as going forth and modeling, putting together this committee and bringing people in who have an understanding of what alerts can do and how beneficial they can be. Also bringing in professionals who understand how to eliminate or at least reduce the stigma in mental health, that we can talk about, educating ourselves and others, bringing along compassion, choosing our words carefully in those alerts, and just being able to empower those individuals over the shame of mental health.
And did any of our other witnesses want to comment on the National Green Alert System? I know mental health was mentioned by one of our other panelists, our other witnesses. If not, then Chairwoman Brownlee, I yield back my time. Thank you so much, and thank you to our witnesses.
Yeah, thank you very much. And I think that concludes our questions to our panel. And I thank Mr. Bearfield, Mr. Blevins, and Ms. Bartlett, the bees. But I thank you all for participating, and your testimony and your written testimony are critically important and will be weighed heavily as we proceed with these bills. And so I really thank you for being here and taking part in all of this. And so I think, General Bergman, do you have any closing comments you would like to make?
Very, very, very briefly, we make progress in little steps, one at a time, but so many times those little steps are tied to others. And I appreciate everybody's input here, not only from the VA, but from the VSOs and from our fellow members, because collectively the results are going to be greater than we could have ever done individually. So thank you all for the time. Thank you, Chairwoman, for the hearing.
Thank you for that, General Bergman. And I will just conclude by saying I thank everybody for being here. You know, it's these hearings are important because a bill has to go through, you know, committee and be heard. That's sort of the first step in terms of a bill becoming a law. So without the first step, we can't get to the second step and third step, which is all critically important. But I hope that for members who have bills here today, I hope you will follow up with the VA. I think they stand ready to help make your bills better. I think the VSOs who are here today and the other VSOs who have provided written testimony stand ready to help as well. So this has been a meaningful hearing, and I appreciate everybody's participation. I thank our witnesses for their expertise and my colleagues for their interest. And so without objection, that includes today's hearing. All members will have 5 legislative days to revise and extend their remarks and include extraneous materials. This hearing is now adjourned. Thank you.